Hi and welcome. My name is Steve. I'm the principal agent with U.S. Benefit Advisors. Last week I shared how health insurance companies are saving their insureds sometimes up to 40% on their premiums with no or low deductible plans. And this week I'm going to carry on something that I mentioned last week, which is the variability in the healthcare industry that you need to know about. And when you understand the variability in the industry, you can use it to your advantage. There's a couple of tools that will help you understand the cost that you should expect for your healthcare procedures. Just like if you were to trade your car in or go purchase a new car, you would want to know what the Blue Book value of that car is. And healthcarebluebook.com is one of those tools that you can use. But before I get into that, let me explain a little bit about the variability that we see in the healthcare industry. So last week I shared the findings from the Brookings Institute's research project called the Hamilton Project. And what they did is they looked at the variability of certain procedures across parts of the country. In their examples, they looked at blood test prices across various metropolitan areas and then C-section prices across other metropolitan areas as well. And the variability across these geographic areas was astounding. In El Paso, for an example, one blood test would cost you around $100 all the way up to $1,000. And in San Francisco, Oakland, Hayward, California area, a C-section might cost you anywhere from $15,000 to up to $40,000. In another research that was done, they looked at the basic blood test cost in various areas across the country, in various cities across the country. Miami had the widest variability from $149 to $725, with Baltimore being the least amount of variability, $22 to $37. This was published in the New York Times and was done by the Healthcare Cost Institute. Very similar study as was done by the Brookings Institute. As I looked into this and tried to better understand why would the variability exist the way that it does, I learned it's because of a lot of different reasons. One, it can be because of the geographic area where your doctor is located. Maybe their rent is higher, maybe their employment cost is higher, but really that just accounts for a small amount of that variation. What's really driving the economics behind this is the negotiations that these large insurance companies, the negotiation power that they have with these providers. When they can send patients to certain providers, whether it be a hospital or a surgical center or a particular doctor, they can negotiate those fees significantly lower because they're basically negotiating a volume discount. And this creates the variability that we see because there's some providers that are in these markets that don't have that amount of volume coming to them, and therefore they raise their prices higher. So while you think you're getting a good deal, what's really happening is you may be going to a provider that you chose that didn't negotiate well with the insurance company, and now you're having to pay more in your deductible and your out-of-pocket expenses for the same procedure that you could go across town with and potentially saved money. There's a big trend happening in the healthcare industry where individuals are opening up their minds to what is going on and realizing that they have the ability to negotiate with their healthcare providers and negotiate sometimes based on the cash price that these providers will accept. Now, when you negotiate the cash price, what you're doing is you're taking the insurance out of the middle. And those providers now no longer need to go to the insurance company to get their money. My mother is a healthcare professional. She's a licensed counselor. And sometimes with these large insurance companies, she has told me that she has to wait 2 or more months before she gets the payment for her services for their patients. So imagine if you're a healthcare provider and your money is tied up for 2 or more months because you provided your service and the the insurance company hasn't paid you yet, then if you come in and provide your cash price or negotiate a cash price with them, they're much more willing to work with you. And in fact, there are studies that have been shown that sometimes they'll reduce their cost by 20 and 50% just so that you get the real value that you intend to get from their service, and they get immediate payment. There's a tool that allows you to figure out what is the price that you should be paying, and I want to get into that next. So healthcarebluebook.com is a great tool that you need to put into your arsenal when you're managing your healthcare cost. And don't think just because you pay for insurance that you're getting the best deal from those providers and from what you're paying in your deductible. So the way that healthcarebluebook.com works is you go into their try a free trial tool. You don't need to be a member, and you don't need to pay for this service. So I live in the Dallas area, and I'm just going to enter Dallas, Texas. And I recently had arthroscopic surgery on my rotator cuff to repair some tendons. So I'm really curious what that would have cost. Now, it was many years ago. I said it was about, maybe 5, 6, 7 years ago that I had that surgery. So I don't remember what I paid, but if I was to get it today, I'm curious what it would cost. So let's do rotator cuff repair arthroscopic. All right, then it'll pop up and say, do you have a Blue Book access code? You don't, because you don't want to pay for it. So just take them to the free site. So say I don't have an access code, and take me to the free site right down here. So this rotator cuff repair that I'd had done arthroscopically in the Dallas area should have ranged anywhere from about $4,115 to over $33,908, with a fair price somewhere around $12,292. And what's interesting is healthcarebluebook.com will give you the cash price discount. So they are telling you there are facilities and doctors that will do this at the cash price, which when you pay up front can create significant savings for you. When you click on the cash price discount, it gives you more details. They've identified the following providers. If you're uninsured or have a high deductible plan, you could save money by using one of these providers. So it's definitely something that you want to look into. If you were a paid member, you would get additional information as well, but it's a great free tool for you to be able to use. So healthcarebluebook.com is a great resource for you to better understand your healthcare costs and manage those high deductible plans so that you get the most out of them for the dollars that you spend. While it may make a lot of sense to get to the top of that deductible, really you need to get the most out of it. But you do have alternatives on top of that. You can look at indemnity plans, which lowers your premium by 40% and provides you a no or low deductible plan. These plans allow you to operate on a cash basis with your providers and benefit from those cash prices that they're willing to negotiate on, sometimes up to 20 and 50%. I hope you found this useful. Again, my name is Steve with U.S. Benefit Advisors. Connect with me on LinkedIn and let's talk benefits.